Right. So since we have everyone and the time is exactly at the hour, I would like to start the webinar. So thank you very much to everyone who has joined. This is the second webinar that is organized by the Asia-Pacific Academic Consortium for Public Health, APAC. And we have all been affected by COVID-19 in many ways. Whether we are working in public health, many of us have been called to action to help out with international or national local responses against COVID-19. And in many ways, all of us have also been affected by the situation in our own countries, where many countries right now have experienced a lockdown of sorts. And increasingly, we are seeing governments, countries easing some of these lockdown measures. So I thought it would be very fitting that for today, through the APAC platform, we get everyone together to really discuss what are the implications and what are the actions that different countries are starting to take as they ease out of their lockdown, or what we call the exit strategies towards the lockdown that countries have implemented. So different countries have actually decided to do different things. And there are different rationale. There's the basis on whether schools should resume, whether retail, whether tourism should resume. We have seen in Europe, in North America, that different countries indeed have adopted different approaches. So over the next 90 minutes or so, I have the privilege of moderating this session, this webinar, together with Dr. Loh Wah Yun from the University of Malaya. Prof. Loh is also the president of the APAC consortium presently. And it is a real pleasure that between myself and Prof. Loh, we will have the contributions and inputs from our panelists. Now, what I'll do very quickly is just to introduce the panelists. And if you could, when I introduce you, if you could just wave, that will be very good. And of course, I should introduce myself. My name is YY Teoh. I'm from the Swee Hock School of Public Health over at the National University of Singapore. So it's a real privilege to be invited to moderate this session. Now, with us today, I've introduced my co-moderator, Prof. Loh. I would like to introduce Dr. Dong-Il An. He's a professor at the Graduate School of Public Health over at Yonsei University at the Republic of Korea. Dr. An. And then,
hi.
And very nice for you to join us this morning. And next, I would like to introduce Dr. Philip Loh, who is the Deputy Director General for the Center for Disease Control at the Ministry of Health and Welfare in Taiwan. Welcome, Dr. Loh.
Hi, everyone. Good morning.
Thank you for joining us. Next, I would like to introduce Dr. Awg, long name, Dr. Awg Bulgiba Awg Mahmud, who is the professor at the Department of Social and Preventive Medicine, Faculty of Medicine over at the University of Malaya, Malaysia. Hi, Dr. Awg. Very nice to see you again.
Hi, thank you very much.
And definitely not the least, Dean Siti, a very good friend of mine. She's professor and dean for the Faculty of Public Health at Mahidol University, Thailand. Thank you for joining us, Dean Siti. Very nice to see you again. Thank you. So as we start this webinar, what I would like is to remind all our participants from different parts of the world, thank you very much for joining us. You would see that there is a Q&A box at the bottom of your Zoom screen. And I would really encourage you, as we proceed this webinar, for you to pose questions. The format for this webinar is really going to take the format of a Davos forum. And what that means is that I will, between myself and Prof. Loh, we will invite the panelists to each lay down 2 to 3 talking points. And during this 2 to 3 talking points, they will be given just a very short time of about 5 minutes. There's no slide presentation. And what we intend to do is to host this as a conversation where we will address issues as different panelists brings up. And the participation, the value of this webinar really comes from your active participation as the audience. So please don't be shy, post questions and we will address as many of them as possible. And in fact, prior to the start of the webinar, we have already received some questions that were very helpfully emailed to our forum by many of you. So without further ado, perhaps I can start off by asking Dr. Dong Il An to discuss what the role of technology has been in allowing South Korea to rapidly perform their track and trace approach of any exposed people, and how does this fit in with the current national strategy as Korea ease out to allow more activities to resume? Because I know that Korea has never actually officially implemented any lockdown at all. Dr. An, please, over to you.
Thank you, Dr. YY Teo. Actually, as you said, that without any shutdown or the stay-at-home strict policy, we have managed the situation by actively utilizing the information technologies for comprehensive contact tracing and quarantine. The information technology IT we have used are actually three: CCTV, secondly GPS, and thirdly credit card transaction informations. CCTV was very helpful to understand the details of the situation in each of the incidents or the event, whether patient, when he or she visits the hospitals or some buildings, whether a mask was wearing or not, whether there was coughing. So to learn the level of the contamination or the transmission by seeing the CCTV, also the population density in that instance, that was very useful. Secondly, GPS also together with the credit card transaction tracing, very good to improve the accuracy and efficiency of the information we got from the patients. Of course, the traditional way of the contact tracing started from the developing the patient diary from the early stage of the patient, what happened for over the last few days, and then we get all the information. But sometimes the patient forget intentionally or unintentionally. When there is some sensitivity issue, intentionally patient tended to omit some information. Also, for the contact tracing in pandemic, speed and time is very critical. So efficiency is there. So question would be whether this kind of IT utilization is just a supplementary tool for traditional contact tracing and surveillance, or this is beyond that level, so become the critical component of the surveillance. That is the question. Answer to me is that in pre-pandemic, this would be a supplementary tool. Without this kind of IT technology, still if the surveillance officers can manage the situation. But when it comes to the pandemic situation, particularly large community outbreak, to me, this is very critical things because by definition of pandemic, we have to deal with the situation without delay. Time is critical. In Korea, actually, we had, when we reached the peak of the COVID, the new cases, we have learned that 9,000 church members in one church were contaminated. So the government decided to thoroughly carry out the contact tracing to the against the 9,000 church members. And then for that, we have utilized all these three technologies: CCTV, GPS, and credit card. And then 200 people were mobilized, including the policemen, because the CCTV and GPS credit card, the policemen are more familiar with. Under the overall responsibility by the EIS officers in Korean CDC. Actually, we found over 5,000 cases out of 9,000 contacts. within a few days. So when we reached that situation, I thought personally, oh, now game is over, it's too late, and it's size too many. So I thought it is impossible. But fortunately, it turned out that our government was able to manage it because of these information technologies. Of course, this IT require platform for better operation. What I mean is that particularly two things. One is institutional arrangement. In other words, the legislative process. When our country suffered 5 years ago with a MERS situation, all the congressmen went through the legislative process to justify using this very sensitive privacy, human rights related personal information for contact tracing, and it is widely accepted by the whole people. That process happened in 4 years ago, 5 years ago. Now, this time, it turned out that that process was very critical. The second platform or the infrastructure, we need the human capacity. As I mentioned, that mobilizing the health officers from other departments, nothing to do with the contact tracing or infectious disease. By the law of the preventive laws, we can easily mobilize from other departments for this contact tracing. Of course, the information technology infrastructure is very critical as well. So in the street and in the buildings, thousands of CCTVs available, and almost 95% of the Koreans use the credit card rather than the cash. So all these kind of things come together, they show us that it works. Whether the YUS question on whether this is part of national strategy, yes, this was the part of national strategy 4 years ago, but as a pilot. But now this is the one of the pillar of the surveillance in Korea. Actually, this experience, this time our experience further guide the national strategy how to further manage the sustainable way of the current situation. That's about my short answer on the our experience on the information technology utilizing comprehensive surveillance system. Thank you.
Thank you very much, Dr. An. So I think what we have heard from Dr. An is that Korea has a very impressive use of technology. They talk about the use of mobile phones, credit cards, GPS location, that really enhance the speed and time for contact tracing. And I think one point that Dr. An highlighted is that all this technology is meant to supplement traditional forms of contact tracing. And I think many of us who are familiar with contact tracing efforts know that humans do lie at the heart of this, that we need to curate some of the signals that the technology produces, which are the false positives that we need to weed out. And I think Dr. An also talked very clearly about the cultural context, because there is the extensive use of credit card for travel, for food purchases, for retail, such that it becomes a useful fingerprint for people moving in different parts of society. And the last point that Dr. An also highlighted is really this rapid and extensive testing, where there is, I know from learning about what happened in Korea, that there is all these drive-through test centers that members of the public can actually go through. There were two questions that were already posed, so thank you very much for the audience that posed the questions, really around the privacy issues, and in terms of monitoring, were there any concerns about technology and the use of technology to infringe on personal privacy? And I think that Dr. An gave a very good context to that as well, because he mentioned that this was the issues around privacy and ethics was discussed in the Korean Congress about 4 to 5 years ago. And I really like to highlight this point, which many of us may not realize, that the way that countries respond during a crisis, especially a public health crisis, does depend on investments. It depends on preparations that has happened previously. And I suppose for a country like Korea, they went through a lesson through the Middle East Respiratory Syndrome, MERS. And so that's why they have put in place certain measures to address outbreaks in the country. So Thank you very much, Dr. An. We'll come back to you with some further questions later on. And I would like to move on to our next panelist. But before that, it's remiss of me that actually I did not mention and to apologize for Dr. Lê Thị Kim An, who is from the Department of Public Health at Hanoi University of Public Health in Vietnam. Dr. Lê An, unfortunately, was unable to join us because she has been hospitalized for a minor issue, nothing related to COVID as far as I was told. But Dr. An sends her heartfelt apologies that she wasn't able to be here with us today. And in fact, we were still discussing whether there was this possibility of another representative from Vietnam joining us. But because the hospitalization happened very recently, over the past 12 hours, so that's why it was a little bit difficult for us to arrange. So apologies from Dr. Lê An from Vietnam. But following that, I would like to move on to the next part, which is really moving on to Taiwan and Dr. Philip Loh. So we've heard a little bit about what Korea has done with the use of technology. And I know that Taiwan has also been very impressive in combining technology with very sound public health principles to keep the COVID-19 outbreak in check. So can I perhaps invite you to share what are the present regulations in Taiwan, especially around public transportation, around eateries, to allow the majority of these activities to resume? I've been to Taiwan, and one of the things that I've always been fascinated with Taiwan is the range of very delicious food. So how is Taiwan coping with the COVID-19 outbreak and allowing life to resume in perhaps the public transport and in the eatery sector? Over to you, Dr. Loh.
Thank you. I just want to echo from what you have said. Smart technology has been widely adopted in Taiwan, probably not as extensively as what happened in Korea, but it really helped us did contact tracing properly. So although we haven't actually closed our border totally, but most of the entry were blocked for non-citizens since March of the 19th. And because of that, there has been actually no lockdown domestically in Taiwan. You can still see schools, museums, bookstores, shopping malls, bus services, train and subway services, and domestic airports. They are totally opening until now. So far, we have only 445 confirmed cases and 7 deaths, with remaining 5 patients hospitalized with COVID-19. The majority of these cases were imported from other countries such as China, European countries, UK, and the United States. And because there has been no locally acquired cases over the past 72 days, despite our continuous monitoring and testing, even we tested the sewage water for COVID-19 and it was no positive cases at all. We determined that the viral transmission in our community is very low and has been stopped totally. So the Central Command Center has just announced last week that all domestic activities and the large social gathering can be resumed after the 7th of June. So you can see people were happily running out to all entertainment park and all kinds of political and the social gathering over the last week. For example, a very big Buddhist Taoist religious gathering involving 30,000 people walking across 5 counties and the cities for 9 days has just started over the weekend. And the organizers, they were voluntarily enforcing universal mask wearing, temperature checking, and hand washing among all these participants. And in terms of our daily life, the government has kept promoting so-called new lifestyle campaign, which encourages mask wearing, social distancing, hand washing, and very interestingly, partition installing in these small eateries and restaurants so as to block the patrons from talking to each other without keeping social distancing. So these were just promoted as a general discipline, but not as a regulation. They were totally on a voluntary basis. The only exception is that the government of Taiwan still require passengers wearing a mask when they want to get on a bus or when they want to enter a railway or metro station. And there is a small fine associated with that if the passengers violate the rule. So far, the compliance has been better than expected after we announced the removal of these restrictions after the June 7th. You would see more than 50% mask wearing in any shopping mall and almost 100% mask wearing in a movie theater in Taiwan. And that's very impressive to me. And we keep monitoring these hygiene practices because it's a crucial factor for us to consider as a community preparedness, because we are in the process of deciding when and how we can reopen our border to foreigners into Taiwan. So that's my brief introduction of what's happening in Taiwan now.
Thank you very much, Dr. Loh. So before we go, I thought it would be useful to highlight that later I'll come back to you around this issue on border reopening, because I think this is an issue that many of our people in the audience would be very keen to find out more, and not just from Taiwan, but from many other places as well. But one question I must ask, that in the United Kingdom, there is now this debate over whether in terms of social distancing, it should be 2 meters or 1 meter. And I just wanted to hear your thoughts what Taiwan is doing in terms of this social distancing, especially in restaurants, that how are people allowed to eat? Are the tables separated at 2 meter spacing or 1 meter spacing, or there's no real rule or regulations around this? Quick question to you, Dr. Loh, please.
So for social distancing rules for indoor environment, we recommend that 1.5 meter as a distance. And for outdoor setting, we recommend 1 meter as the distance. But it's very difficult to follow that in a restaurant. I mean, in this Asian culture, you can always see very crowded and a packed restaurant setting. Unless it's a big hotel restaurant, it's very difficult for small eatery to follow that. So instead, the alternative is that we encourage installation of the partitions. So for each patrons, if they have these blackboards as these blockers as partitions, and it's like in ramen restaurants, sometimes you see these boards separating patrons. We encourage that to be installed, and there is a small incentive for them to do that. So this has been followed in quite a few eateries here, and our commander, the minister, even visited these eateries to promote and encourage those installations. That's what's happening in Taiwan now.
Thank you very much, Dr. Loh. So thanks for the questions that are coming in. So we have received some questions around schools, and because what I would like to do is I will group the questions around school till later in the webinar, because we have a special segment that's dedicated to discussing schools as well. So please keep those questions coming. So Wyan, over to you.
Right, thank you so much, YY. Okay, let us now move on to Thailand, Dean City. Now, Thailand, has always been, very dependent, on tourism, and that has seriously been affected because of the COVID-19. And I believe your tourist arrival this year has actually dropped by more than 6 million, just for this year due to COVID. And a lot of people has actually, abandoned their overseas trip. I'm just wondering, Dean City, whether you would like to share with us what is Thailand, in fact, envisioning after the state of emergency, because you are easing off, your lockdown, at the end of June. And what is going to happen? What are your border control measures right now, and also from July onwards? Could you share with us some of your, border control measures?
Thank you, Dean. Thailand has working on different levels that working together. So the issues about tourism is very much of concern. People in Thailand have learned that they have to do social distancing. They have to have different measures that they need to practice. However, the tourist attraction throughout the country. So it's not only in big city, but in the homestay, all of those. So what we need to do is to let people understand and adjust their new normal. So the new normal issues, what they can do and how to practice. And right now they have the Thai Chana application, which is the contact tracing and identifying the number of people in the cluster wherever they go. So it's like giving a person in Thailand to make a decision based on the information that the government can provide. So from now on, what we will see is everybody are very much concerned and trying to protect themselves so that the economic will come back, because the tourism is our major income. So I believe that the nature of the country, which is more on the caring and sharing. So the reputation that we able to accomplish no new cases that identify and able to helping each other. So that's our social capital, which will help, inviting the tourists to come back. But now the government are talking about the bubble traveling, and people are very much concerned whether we're going to invite people to come, or the lockdown traveling ban, and how are we going to do that. So they promote the in-country traveling for the next month. And we are waiting to see, we are excited every 11 o'clock in the morning, because it's the time that the government will release how many cases that identified, and we keep praying that no new cases, within the country. If it's happening in the state quarantine, it means that everybody in Thailand are doing good. And if we are keeping up on this, then we will invite our tourists to come back. So we're still learning a lot, but I think the nature of the country, which is different from other countries, that even though we are fighting, arguing, but when it comes to the crisis, we all together. And I think I would like to say that we have 5 C's in the nature. If I wish to share, the country committed to public health. As you may see that we are Mahidol University, and we taking into account what does it mean in the public health and the development of the country. We also have the caring and sharing society. You may see that a lot of culture that we can add into the tourist attraction. The third one, you heard about the mask, Thailand fighting on identifying where can we find the PM 2.5 mask on all those. So we are very creative. We have a lot of design, right now, even the king and the queen, providing us with the nice looking mask, so it become very attractive. Everybody, when we dress up, we are ready to choose which mask that we're gonna wear. And we are collaborative, Everybody say work from home is our strategy. So once they said reopen, now we are starting to think, how can we reopen? Because we are now used to work from home. And finally, Thailand is very unique. We are not a reading society, we are talking society. So a lot of creative television program, the radio program, studio from home within the country. So I think that when we are reopened, Thai people throughout the country are ready to invite our guests to come back, because of all of this happening with the social capital of the country. And I have to mention that because we have the village health volunteer, which is the backbone. It's proved now that village health volunteer is the backbone of our public health system. So we can, they have a function, or they are part of the business in the rural area as well as in the capital. So they are the one who help supporting the rural people who offering tourism of the hospitality. So all of those can be advocate of change. So the new tourist attraction will be created.
Right.
So I think we can come back.
Yes, so yeah. Excellent, Dean City. So it's very clear that, you know, what Thailand is doing right now, it's basically promoting your domestic travel, but international, you're still monitoring the situation before you can actually open up to the world again. And of course, I mean, no doubt, you know, tourism is the one, you know, that is the backbone of your economy. So thank you very much. There are other questions that are being asked. I will post you those questions later on once all the speaker has actually given their piece. Over to you, YY.
Thanks, Warren. So, Dean City, thank you very much for the 5 C's. Committed to public health, commitment to public health, caring and sharing society, creative nation, and a collaborative nation. And I think the last, which I got correct, it's culture and social capital in Thailand. So those are very important concepts that we very seldom hear about, actually, when we discuss COVID-19 responses. So thank you for sharing that. So I thought, following what we have heard from Dean City about what's happening in Thailand, I would now like to move on to Dr. Awang to really share briefly what's in Malaysia's plan for easing your restriction, which you call the movement control order. And I know that this easing will actually start from the 10th of June. Well, it started from the 10th of June, but it will take a period of 2 over months until August 31st. And you call this your recovery movement control order phase. Perhaps, Dr. Awang, you can take us through what is happening in this period. Over to you, sir.
Yeah, thank you, Wei. For those who are not familiar with Malaysia's lockdown, what we call the movement control order, now the movement control order was imposed on the 18th of March. And the first movement control order was extended several times until about the 3rd of May. And then the movement control order, which was actually the start of the easing of restrictions from the 4th of May to the 9th of June. And now we are in the third type of the movement control order, which is called the recovery movement control order, where almost all restrictions have been removed. That's from the 10th of June, as YY said, to the 31st of August. Now, this movement control order was based on the application of two pieces of legislation. One is the Act 342, which is the Prevention and Control of Infectious Diseases Act 1988, and the Act 344, which is the Police Act of 1967. Now, why we had to use two acts was because the movement control order required the application of controls of travel. For example, interstate travel was banned during the MCO, and international travel was banned, and so on. So there were a lot of restrictions. So during the MCO, in the first phase, you were not allowed to travel more than 10 kilometers from your house. So the police set up roadblocks, and I think hundreds of people were issued fines because they traveled more than 10 kilometers from their homes. The police checked the identity cards and said that if you're, this is more than 10 kilometers from your address, and so they were fined. Literally, I think thousands of people were fined. Eventually, I think the compliance was very good, and so the government decided to ease the restrictions from the 4th of May. Now, the easing of restrictions was called the Control MCO, and or we call it the CMCO, meant that most businesses were allowed to open, except for entertainment outlets, sports, hair and beauty salons, and but interstate travel was still banned during the CMCO. And social and religious gatherings were all banned. That meant that the Hari Raya or the Eid festivals, the harvest festivals, or the Gawai Dayak and the harvest festivals in Sabah were all severely curtailed, with almost very strict restrictions, and spot checks were made at homes, for example, to ensure that people complied. Now, 4 weeks after the CMCO, because the CMCO was for a period of 4 weeks, although most businesses were allowed to open, interstate travel was still not allowed. And because we didn't see any cluster coming out from the festivals, that meant that compliance was really quite good. we went into what we call the RMCO, the Recovery Movement Control Order, where practically all sectors were open, except for entertainment outlets again. Contact sports was not allowed, but gyms have been allowed. Interstate travel was allowed because most of the states had recorded 0 cases for a period of 14 days, for example. International travel is still not allowed. So you can't travel outside Malaysia. Malaysians can come back home, but during the movement control order and the control MCO, any Malaysian coming back was subjected to a quarantine of 14 days in a quarantine center. So they were tested, and before they were allowed back home. Now that we are in the RMCO, any Malaysian coming back do not have to quarantine in a quarantine center. They are allowed to self-quarantine at home, but they are still subject to the Police Act, so which meant that they could not freely come out. They have to wear a wristband, which indicated that they are still within the quarantine period, and only after 14 days, and if the results of their swab test was negative, would they be allowed outside the house. Now, domestic tourism has been kick-started. The government provided a number of stimulus packages. For example, this is the 3rd stimulus package which the government has come out with. There have been some easing on social and religious restrictions now. I think churches, mosques, and temples have been allowed to open subject to 1/3 capacity. So, for example, if a mosque had a capacity of 1,500, now 500 people are allowed to pray, to enable some physical distancing, and so on. Schools have been reopened gradually. Forms 5 and 6 have been reopened, but the rest of the schooling is restricted now to just homeschooling and online teaching. So it's RMCO, I think, is for a period of 2 months plus. It's until the 31st of August. But it's already a period in which we can see, I think, further restrictions are coming on. And I think YY is probably going to talk about this later on. So I'll stop there for the moment. And we are hopeful that there are no new clusters which have been discovered, and the cases have all been and have all gone down. The number of new cases have all gone down, and the healthcare system is not under stress at the moment. The lowest number of new cases was on the 10th of June, where there were only 2 new cases. And that's despite 35,000 tests being performed every day, I think, on many mainly migrant workers now. So most of the cases now are among migrant workers, I think, mirroring what has happened in Singapore. So we are trying to test as many of our migrant workers as possible. And this is where the case is coming from. Thank you, YY.
Thank you, Awang. So it's very exciting hearing you talk about the RMCO, the Recovery Movement Control Order, because for yesterday in Singapore, our ministers announced that Singapore will also have a greater degree of easing, and that would actually start from this Friday. But it's very similar to what you've described in Malaysia and what Dean Siti has mentioned in Thailand, that the easing has been very calibrated and very cautious. It is happening in steps, taking step by step. So for example, you talk about entertainment outlets not allowed in Malaysia. It's the same in Singapore. We are a little bit more conservative. We have not even allowed religious gatherings to happen from this Friday onwards. It will still not be allowed. Schools, however, will reopen completely in about 2 weeks' time. So currently in Singapore, we have our phase 1. Schools are perhaps functioning at only 50% capacity. So they divide the school into half and half. So 1 week, this half of the school will appear, the next week, the other half. But from 29th June onwards, all schools will resume. And actually looking through the questions, there have been a number of questions also centered around schools. So I'll come back also later on to address some of the issues around schools. But right now, I think one of the aspects that Dr. Awang, you talk about is on international travel. I know in Malaysia now, interstate travel is allowed, and that's the same for Thailand as well. Domestic travel is allowed. Unfortunately, Singapore, we don't have much domestic flights to talk about. We can still travel domestically, and in fact, that's what we hope to be doing in phase 2, but we don't have domestic flights that we fly to different parts of Singapore for different forms of tourism. But I actually, one of the issue around travel and tourism, it's really around this issue of quarantine. And for some of you in the audience, you may be aware that in the United Kingdom, there's a lot of debate and discussion, including potential lawsuits by airline companies against the British government, the UK government, because the UK government has imposed a 14-day mandatory quarantine that any incoming travelers into the United Kingdom, except from if you are departing from various parts of Europe, you have to spend 14 days in a quarantine situation. So this is going to impact tourism very significantly. And I want to come back to Dr. An, our colleague from South Korea, to perhaps very briefly describe what South Korea's border control measures are presently. Dr. An, are your borders currently open for mass market tourism? And if so, any inbound travelers, do they need to be quarantined for 7, 14 days? Can you perhaps educate us a little bit about what South Korea is doing with respect to its border control? Dr. An, please.
Okay, thank you, Mr. Chair. I think in Korea, we have maintained the so-called open border policy as much as possible from the beginning. So when initially many countries canceled the flight from many parts of the China, we have still opened it except the Wuhan and the Hubei. There was a lot of debate internally, domestically here, among the experts whether there's the right way or not. And then still we open we keep that one domestically as well. The reason behind that is Korea CDC and many experts here believes how to manage the local transmission might be more important and more critical than strictly control the border because of pandemic. Pandemic by definition, anyhow, somewhere, sometimes virus is coming that we cannot stop it. So for the current situation, we have many inbound visitors, but the 90% of the inbound travelers are returning Koreans, mainly from US and the EU. They are basically the students there, but because of the converted to online system, they want to come back to Korea and then join the school remotely. Also, our case much lower than these Europe and the US. So many Korean students coming back that occupy the 90% of the visitors, and only 10% of the rest are foreign workers from many of the Asian countries. And then our local transmission or our domestic cases reached down almost to zero on the middle of the March. And then around that time, 20 or 30 COVID cases among the travelers. So from that time, we have enhanced the quarantine. So we have applied same like Malaysia and other countries, 2 weeks mandatory quarantine. So all the inbound travelers are given the test in the airport, and they positive, then definitely move to the treatment center or the hospital. But if negative, then 2 weeks mandatory self-quarantine with the smartphone application and very actively monitor the situation, whether using the GPS and others, whether people stay either in the hotel or in the regional places, sometimes sudden visit, and if there is violated, we apply around, I think, the $10,000, quite a heavy amount of that. Overall, our sense is that the border travel, border control is less important than managing the local transmission. Partly due to that, we have established active and very aggressive contact tracing and the testing system. that made people reasonably okay. Even we are a bit loose in terms of border control. That is over our situation now. Thank you.
So Dr. An, if you could just stay on for a little while, because we have a question from one of our audience who really asked about the Australian government, because the Australian government is starting discussion to allow people to come in, and that people could be business travelers, it could be tourists, and more importantly for the Australian economy, it could be students. So from the Korean perspective, what do you think would need to happen to allow Koreans to travel over to Australia?
I think there's an exception policy for 2 weeks self-quarantine. Those business investment or business contracting people or humanitarian purpose or participating international conference or the government officials, they can submit the waiving of the quarantine process through the Korean embassy before they come to here. And we try to activate and maintain the business as possible, but also we do have some number of the students going to Australia and New Zealand as well. I'm not that familiar on these areas, but overall sense here is that people are a bit afraid of traveling. Almost nobody seek the tourist the travel. So all the students are coming back, and they believe Korean health system is reasonably cheap and okay. So they wanted to stay in Korea as much as possible. So I'm not sure whether students going to the college in Australia, for example, they would push through. I have some friends who postponed their joining to school in America and other countries even after they have some permission. So overall sense here is domestic travel okay. We gradually enjoy the picnic and outdoor activities, but we hardly see the tourists going out. So unless very critical business, I don't think Koreans are ready to go out that actively. That's over our sense here.
Thank you very much, Dr. An. And I think the message is very clear there, that I think at the end of the day, people currently are still afraid of traveling. And at least for the Korean side, for people who are coming into South Korea, there is still a very clear requirement on the 2 weeks quarantine. And you mentioned that there is the possibility of applying for a waiver at Korean embassies, but I read that as this is really the exceptions and not the norm. So for mass market tourism, there is still quite a significant hurdle for the public to get across in terms of confidence for traveling, as well as the systems to be put in place, whether it is being swabbed and tested at the point of entry at borders or in terms of this 14 days quarantine. And I hear loud and clear that there is a fine of up to $10,000 US if one actually fails to meet some of the requirements for the quarantine. So that's an issue that we really have to be aware of. But before perhaps I move on to Wah Yun, before that, I would also like to ask Dean Siti the same question, because I know that between Australia and Thailand, Australia does contribute quite a lot to Thailand's tourism. And every year there's quite a lot of Australians coming into Thailand for tourism. And equally, there are a number of Thai students who will pursue their university degrees in Australia. So Dean Siti, over to you. What are your thoughts to the question that was posed, especially in terms of what do you think either Australia or any other governments need to do to encourage, to generate that level of confidence, both ways, for outbound and inbound travelers, especially for a country like Thailand that is very dependent on tourism dollar. Over to you, Dean Siti.
Thank you, Dean Wai. I think Australia is also one of our strategic partner in education, especially at our university, Mahidol. So we are talking about the concept of not only bubble traveling, but also double education. So the discussion was on whether the countries has a good system which can control or make people literate. You know, health literacy comes in to assure that an individual, students or people in that country able to make the right decision, because controlling the disease is very much depend upon an individual hygiene. If they can make and apply the information regarding that health status. So in our university, we started to see to pair up with the university in the country that has a good surveillance system, good information giving, and good practice. So we are now talking about which country that is good, like in China, in which area, what university we are talking about. So strategic partner become part of the decision making. Another issues that we are trying to apply is whether the countries that coming into our country has a good record of controlling. So each level, if we are talking about the ecological platform, we're taking that into consideration. Not only an individual with a good academic record, but at the same time, we redesign our education so that students can have access to our facility, similar to the world now we are talking about online. But in applying for the public health education, we are talking about how to blend different methods into it. But we are very much concerned that students from countries where public health system and infrastructure for the digital technology can be matched with our system. So we started to talk about identify partners and exchange, and we have the guideline of how to make decision of who you want to exchange, students or faculty members. Now we are talking about doing research. I think comparative research will allow us to promote quality education. And give you an example that we have our students all over the Asia region, and we working with the partner universities to provide exam, to provide field training. And we also partnering with the international industry so that we change from the community-based into workplace and apply public health into it. So I think that if we choose the right country, choose the right context and university partners, and we work together so that the model of education allow us to exchange, and public health can be applied to any of the settings, including tourism. You know, we apply for the community or the province where there is a good system, but we have to promote tourism. We choose our campus in other provinces and how to help people in that community integrated the health issues into the tourism and agriculture. So coordination among ministerial level, education level, in institutes and the community people. So all of these concepts remain tourism, public health all together. And that might help us to secure the health of the people, secure economic development, and also create the smart farmers who had or who are literate in public health. And that's what the way we are applying to the government.
Thank you very much, Dean CT. Warren, over to you.
Right, thank you, Dean YY. Now, I think we have heard from most of the speakers here just now about the impact of COVID-19 on education, and most government around the world has actually closed down educational institutions in an attempt to contain the spread of this COVID-19 pandemic. Now, Dean City, I'm just wondering about plans in Thailand for schools, because I believe your new academic semester, although it has been delayed, is going to start, July the 1st. Could you share with us some of your plans as to how you are going to open up and encourage, students to come in?
Thank you. That's the issues that we trying to lead. As the public health school, we want to be the new normal public health school. So because we have the national guideline and we have the university guideline, so we applied it. So right now, I think we are revisited our philosophy and we create a system. In fact, we have changed our field internship into the Faculty of Public Health as a community internship, and we have to reflect it on our students' daily living activities to apply it in an individual students. That was we accomplished, and we are certain that because we able to adjust our field internship in public health into the faculty, which means that the faculty physical and social distancing is applied. And we also apply the application, we have chatbot. We cannot use mobile application because of the Google and Apple regulation. I think you all affected by that, right? So the mobile application is out. We cannot apply it. So we use the line chatbot and we create what's so-called by the bot for new normal. In fact, if you are here, I can show you, I can send the link. So our students will use online, but they will come back to the school, to the faculty. Every morning, they have to do the health status report. And we determine where to enter the faculty, And after that, in every classroom, we apply public health concept. We monitor air quality. We monitor the distancing in each classroom, staff's room, and laboratory. We apply the new guideline so that students will help as a community, people in the faculty will help to maintain the hygiene of the settings. We also redoing the cafeteria. We stop, I hope they will follow, we will stop using the bill by using the easy transferring of the money, QR code is applied for all. And we monitor number of the students and staff who can come in so that the social distancing applied all. On all of this, we have trying to create a data center. Why you love this? Because I think that it is the turning point for public health education because the lifestyle of the people had changed. So all of our survey on the behavioral and lifestyle survey have to redo it. And we have to have that data in order to design public health curriculum. We cannot use the past data set at all. So please come and help us to redo the data center for public health curriculum development. Everything is so excited. And I hope, we are working with the alumni because our alumni in all sectors are now seeing that public health school had to change. And we're inviting them to join and redesign the curriculum. So partners in different countries can also holding hand with us to create a new curriculum of public health. And I called it the new normal curriculum. Is it exciting yet?
Thank you, Dean City. That's really exciting, and we can hear. I think all of us, in fact, are sort of crying for help. As far as the delivery of education is concerned, because I think with this COVID-19, all of us have to start, thinking out aloud and changing our strategies in terms of delivering, the content, of our, our lecture. Now, let me now move on. Perhaps Dean YY, would you like to share with us what are the steps that you have taken as far as schools are concerned in Singapore?
Thanks. Well, so what has happened in Singapore is that actually schools are allowed to resume from the 2nd of June onwards. And I mentioned earlier on that about half of the schools were, half of the students in every school were allowed to return, but face mask wearing, safe distancing of at least 1 meter. We can come back to this contentious 1 meter, 1.5, 2 meters requirement. But in Singapore, it's still 1 meter at the moment. And there are staggered timings for recess, for even school exit when students leave the school. All this timing are staggered to minimize crowding at the bus stops, at the gates, and so on. So that has, so far what we have seen is that the measures that have been put in place have been able to keep transmission to a very low degree. In fact, so far, I don't think we have any transmission that is due to students mingling in schools. And I see this as some of the lessons that not just within Singapore, but internationally, we have to start thinking about for schools to start resuming. And actually, it's very nice that you ask, because I wanted to find out from Taiwan, which has done extremely well. I'm not sure right now they are at 40 over days or 50 over days with 0 transmission so far. That Dr. Philip Loh, what are the measures that are taken in schools actually to prevent kids from being infected? Especially, when students come to school, when they leave school, they do take public transport. So I think that's one question that I would really like to ask. And there is actually a second question that was posed around education by one of our audience member, really around overseas students that are going to Taiwan for their lessons, for their studies, that around what are the border control measures at the moment, especially with regards to the issuing of visas for students to come into Taiwan for them to resume their classes. So 2 questions. The first is really, what are the measures that Taiwan has put in place that really help to minimize infections within schools? And then I'll come to the second question in a bit. Philip, over to you, please.
Thank you. So the school parents in Taiwan, they were pretty alert since the beginning of this response. During the Chinese Lunar New Year, everybody in Taiwan was watching TV about what's going on in Wuhan, and people were like horrified by the lockdown experiences there. So even the government didn't require, but nearly all parents require their children to put on masks after the New Year holidays. And the school teachers were also voluntarily checking students' temperature on entry of every day. So this is mostly learned from the SARS experiences, the tragic SARS experience in Taiwan, 2003. So a lot of these were done voluntarily, and the government just guided, like by providing enough face mask, providing enough alcohol sanitizers. Actually, we were in shortage of these materials at the beginning, but later on, because of catch up of the production, the school were pretty happy about supply of these materials to protect their children from getting ill. And so far, we only had one case in school, and that was actually a student who returned from Turkey during the February holiday. So it was not associated with a school outbreak. So I think widespread mask wearing in Taiwan actually protect the community, including the school, from getting local transmission in this response. In terms of policy of our border control, I think as a government agent, public health agency, we face a lot of pressure from other ministries and also private sector around about to enhance our economy and to protect the tourism industry, we should open up the border as soon as possible. But as public health agency, we still keep that gold standard of 14-day quarantine policy in Taiwan. And we look at our capacity here. So far, we've managed to build up 10,000 rooms on quarantine hotels and quarantine centers. So it means that if we want to strictly implement that 14-day quarantine for any foreigner, we could only allow 10,000 visitors during the 14-day period. Otherwise, all this capacity will be occupied. So a policy in terms of relaxation of border control in progress is, I can say, is country-based and test-guided quarantine. So for foreigners traveling on business purpose, I think this will be our first wave of relaxation of our borders by application only. If they can show that they are really going to Taiwan, not for tourism, but on a business purpose, like for example, have an invitation letter from our domestic industry, then they are allowed to come. They probably will be allowed to come in by the end of this month and subject to 14-day home quarantine in a quarantine hotel or home quarantine center. The trade-off is this will occupy our capacity of quarantine. So the citizens that are allowed to come in will be compromised probably. So we are very judicious of allowing the quota of this country-based selection. So for example, Vietnam, New Zealand, those with low or zero community transmission country will be on the first list. And for foreigners on traveling on business purpose for short term only, if they really have very urgent business, we are thinking of alternative strategies such as shorter quarantine period. So if they can provide a test negative certificate on entry, and they are willing to pay for themselves for a serial testing, a PCR testing, for example, on the 5th stage of entry, if they test negative, we will probably allow them to go out for 1 day or 2 days and return to the hotel. And if they are willing to receive another testing on day 7 or day 10, then they will be allowed to come out for 1 or 2 days again. So this provides a relaxation of the strict home quarantine rule, but it's still under a lot of debate because we don't want to increase the risk of local transmission because of these foreigners. We'll see what's going on this week because of the policy making process. It will have to go to the Prime Minister's office. So hopefully tomorrow or the day after tomorrow, you'll read from the news about Taiwan's final decision about the relaxation of this foreign policy entry. So that's a brief summary. And the second wave probably will be open to foreign students as well. And we are asking the universities, colleges to build up their own capacity of accommodating these foreign students. They have to have single room and together with a single restroom in order not for these students to have contact with other students, so as to protect them from getting infection from other foreign students as well. And this will probably happen in our summer vacation. So these are some of the progress I want to tell you about.
Thank you so much, Philip. So I think it's quite clear that Taiwan, like many other places, the rules are changing very rapidly, are evolving very rapidly because the outbreak situation in different parts of the world is changing very quickly. And I think especially for border controls, for people coming in, whether it is for mass market tourism, for business, or even for students, for studies, I think those will really need to look at both the outbound country, the country where we will be receiving travelers from, as well as what is the situation locally as well. And I think it's very clear from what Dr. Loh has shared that the quarantine requirement, it's still expected. It is still a mandatory requirement. So in terms of the visa, the particular questions around visas, I suppose the most appropriate answer is to follow up with the universities or the schools that particular person has applied for. And I suspect more news will be available as the situation in various countries, it could be Singapore, it could be Malaysia, in various regions, various parts of the world as it evolves. And actually on this part, having also heard Philip say, I think it's quite clear that I can forget about my plans to go to Taipei for a holiday this year. But following that, maybe I can also ask Dr. Awang, can you also share a little bit about what is the current school situation in Malaysia, especially as you are now in the recovery phase? Are schools allowed to resume completely? And what are some of the precautions that your schools in Malaysia are putting in place to make sure that students are protected when they return? Over to you.
Yeah, thank you, Wai. Since the start of the MCO on 18th of March, much of schooling has been stopped, and schools were supposed to start teaching online. So term exams were scrapped for the whole year, but the online teaching has not been consistently applied. So it very depended very much on which school that you go to and so on. So some kindergartens, some schools, in fact, took the initiative and instituted their own online teaching using Zoom, Google Meet, Instagram, apps, and so on. But it's not that there has been no move to reopen schools. In fact, when I looked at on social media, what the NUTP, for example, the National Union of Teaching Professionals were saying about opening of schools, they had been pressuring the government to introduce dates and when schools will be open. And coincidentally, I was interviewed about schools on national TV on the 2nd of June. And I opined that the schools and universities could reopen as long as it was done gradually with proper SOPs in place and staff and students being educated on following these SOPs. So I don't know whether it was a coincidence, but 2 days later, the minister announced that Forms 5 and 6 would be allowed to reopen. And a whole series of SOPs have been issued. But the school reopening has been limited to Forms 5 and 6 now. Now, I opine that we could open gradually and on a staggered basis how you do it, because the SOPs about hand hygiene, about distancing, about staggering have already been issued. And the problem with home classes at the moment is that because Malaysia is a country of about 32 million people, and we have not very consistent access to devices and fast internet access, and there is no standard online curriculum for schools. So it has been inconsistent, and the fear on educators such as myself is that there will be a generation where the digital divide, for example, it will become worse in the coming years, and this will affect their university schooling in the future, and of course the economy and so on. Universities are in a better position as several years ago, the Ministry of Higher Education had forced universities to embark on blended learning and MOOCs and so on. And in fact, when I was provost for the University of Malaya, we started implementing what we call the e-learning week 4 years ago in 2016, coincidentally, to prepare for a pandemic such as this. So we thought that if push came to shove, that the entire school, the entire faculty, for example, would be able to implement almost everything online. So for a whole week, we started off with just 4 faculties, then we expanded to 8, and then we expanded to 12. So almost the entire university has been prepared for e-learning as far back as 2016. So we didn't think that we would ever have to use such a mode of e-learning, but it was something that as an epidemiologist, I thought we had better be prepared for. So when I was provost, it's a coincidence that, because I became provost, that we had to prepare for this. And why we prepared for this was because there was a lot of scare about Ebola at that time. We had West African students and who went back home for the semester holidays. So we thought, okay, if Ebola is, is a very frightening disease. So if any of them had come back with Ebola, then I wanted the university to be able to prepare for such an outbreak. And we went to the extent of putting in SOPs and protocols on how we'd be able to isolate these people, and got our BSL-3 labs all ready to prepare for such this kind of situation. But anyway, like I said just now, schools are reopening, but slowly under the RMCO. And again, we have been urging the government, because I'm leading a task force called CEASE. It's a COVID-19 epidemiological analysis and strategies, that we really should do this in a gradual manner and a staggered manner, and notwithstanding the problems that we know in schools, because there are many schools which have double sessions, meaning a morning and an afternoon session, which means they're quite packed, and the class sizes are very large. So we would have to think about all this. I have been reading the SOPs which have been issued by the Ministry of Education, quite comprehensive really. So people have been working on how to implement this. The only question is when. So this question has been posed, I think, to the Minister of Education. In fact, I've been pushing for a timeline for when schools would be, 50% or 70% or 100% will be open, with certain provisions in place. So that's the situation in Malaysia right now. I think it will gradually reopen. I do not think that the original plan of no schooling at all until the end of the year is a good idea, probably a bad idea. But how you do it is another question. As I said, Malaysia is a country of 32 million people, and there's varying access to internet and devices and so on. But it can be done. Thank you, Wai.
Thanks, Awg. And I thought at this point it's useful to also share that the experience around schools are really different across the world. For example, in the Philippines, that the president has actually closed schools indefinitely until a vaccine is available. And at the moment, no one knows whether that is a very sound call, because indeed there is a lot of concern that schools can be a conduit for the coronavirus to spread. And over here, I would like to turn to Dr. An, really about to find out of the South Korea experience, because in South Korea, schools were open, but they were subsequently closed after there was a spike in the number of transmission in the community. And I wanted to ask Dr. An that, do you think that this is likely to be what the world will be facing, especially when it comes to schools, that in China, just yesterday and today, there were again schools closed in Beijing because of the clusters that have emerged, firstly in one market in Beijing, and then now I think there is a second market that has also been found to be affected. So in Beijing, they have closed some of the schools around those markets. So Dr. An, do you believe that this is likely to be what the world will be seeing? There is a need for periodic closures of schools, of workplaces, especially as transmission in the community fluctuates up and down. And I like to also ask very specific to the preschooling sector. These are very young children, because I think there are many parents around the world that are very concerned in sending preschooling children back to schools, because concepts such as face mask wearing, such as safe distancing, such as personal hygiene, to a toddler that is between 4 to 6 years old, those concepts are extremely difficult to enforce. So Dr. An, sorry for the difficult question, but over to you to guide us on the Korean experience, please.
Okay, thank you, moderator. Actually, we scheduled to reopen the school sometimes in March, following the good example of the Singapore actually. And then one day before, or on the same day of the opening day, unfortunately, we coincidentally found the COVID cases, so we postponed, and then it happened again. So 3 or 4 times postponed. So around more than 2 months has been postponed. And then but there was no any secondary infection or school outbreak. And then is the just same day because when students come, then when we opened it, everybody were requested for fever checking, and then we found the cases. So that on the same day, just close the policy, change the policy, and all closed it. And then finally, from middle of the May, gradually up to the 8th of the June, all our school finally opened it. For around 6 million students now joined the school. So far, there is no any the outbreak in the schools. But still, it is the hybrid system, as Singapore, as the chair mentioned, that we also every 2 weeks or every 3 weeks for around 1 week period we attend in order to make school class size from typically 30 per class to 15 or 10. 1/3 or half of the time they stay in the school, but the rest of that is online basis. So it's a hybrid system. And fever check every 2 times every day, and the mask is a must. And then the distancing the chairs and 1 meter in cafeteria and toilet. If new cases occur, so far no, but if something happened, then immediately that specific school would be closed, and self-quarantine for all the teachers and all the whole students will be given. Will be required, and then the COVID test will be given to all the students in the same class of the patient. So this is the current policy, and we have to see whether how it happened. Actually, our understanding is that the school, particularly the more kids and young children are less transmittable and less susceptible to the COVID infections. In a way, they are rather safer, and in terms of the transmitted disease or the affected by the virus. But there is our scientists believe, but there is sensitivity because here we have to deal with the view of the parents. They are not the scientists, and simply the younger the parents are more just wanted to keep their children just safe. Even they don't have the elderly people in their family sizes. So view from the parents one thing, and then the Ministry of the Education has another voice. They are normally not the scientific. I mean, they are not the public health experts. So that it's a bit tricky and sensitive, but as Chair said, that my answer would be, or my sense is depending on the country context. For example, if some countries cases of the daily cases of the new patient are rather low, and the reproductive number is also less than 1 or rather low, then perhaps school is some areas, opening the school is one thing we can actively try. Actually, according to some study in Yale or the Michigan, I forgot, then they have some survey to U.S. citizens, and they believe reopen the school is the first trade-off agenda rather than anything else. So they seems to be general sense that they are ready to try out the reopening for school. And then at the moment, our situation is that the final decision whether to attend the school or not given to the parents. It means we are very sensitive on the parents' views, and we want to respect whatever the reason, how parents sense, and so we give the judgment to the parents. So even they do not attend the schools, we consider its attendance, and then they can enjoy the online way. So that is the current situation. I'm not sure whether my comment give the full answer to you, but scientifically we understand that the school is rather easy areas, but in reality, because many stakeholders, we found that this is a rather tricky areas. Thank you.
Thank you very much, Dr. An. I thought that was a very important answer that you gave, because often people do not see the complexity behind schools, because when children are allowed to return to school, that's also when parents are allowed to resume some of their economic activities, such as their work. And every time we talk about the use of home-based learning or the use of e-learning, the reality, as was pointed out by one of our audience member, Teresa Natalia, is that internet-based curriculum or e-learning really is the privilege of countries with a certain degree of financial achievements, that you are able to have access to Wi-Fi, to laptops, to computers that allow students, children to be schooling at home. And the reality is that globally, especially in many of the low and lower middle income countries, that is a luxury, that is a privilege that is not accorded to many people. And equally, I think what Dr. An has highlighted, it's a very clear fact that many of us must learn to understand that as measures start to be eased, and this includes schools, the reality is that having put in place safety protocols or hygiene protocols, disinfection protocols in schools, at workplaces, they do not mean that there will be zero infections. And I think that as a public health community, it is very important for us to appreciate that and to communicate this very clearly to the audience, that the reality is that it is not about preventing infections completely, because the easiest way to prevent infections completely is actually to have a strict lockdown. Everyone stay at home, very little interaction, infections will drop. But the reality is that we have to balance that with jobs, with the economic drivers, that people need to maintain a degree of livelihood. So what I've always mentioned is that as countries ease their lockdown measures, it is more important for countries to put in place measures that allow them to find cases very quickly and to isolate, to track people very quickly. Those are more important than constantly focusing on having low case counts or zero case counts. And there is a very good question that was asked earlier on as well, which is around what are metrics that citizens should be using to more accurately assess the impact and the severity of the coronavirus outbreak. We will come to that in a bit, because I think that is also an issue that we should address. But Warren, I know you have a question. Over to you, Warren.
Yes, thank you, Dean YY. Yeah, I think right now, I think all countries, will have their own individual exit strategy plan. So coming to you, Dean CT from Thailand, I'm just wondering, in Thailand, your exit strategy plan, what are some of the factors that should be considered in this exit plan?
Well, what I'm trying to advocate is to let people make decisions. So what we have to prepare is prepare each individual in different contexts to do participatory surveillance. Because so far, I agree with what DYY said, that we have to find a balance between the infection, quickly identifying the case and separate it, right? So if we want to have the whole country safe and secure, participatory is important, and controlling it from the individual level to the society level, working together. So in order to prepare the country to reopen, we need to know ourselves what we can and we cannot do. We also need to share information and have the same goal, that if you come to school or if you come to Thailand, this is the trusted information, because without trust, we cannot work together and be in a good health. So advocating participatory as the principle of public health. So disease control is not totally zero, as you mentioned, but each individual need to participate and learn and make decision to be literate and health literacy and health literate society. Now we want to have the global literacy on the COVID and new emerging disease to come. So don't control the people, but let people participate and learn. Having the second peak is not to happen, but having it, we will test ourselves whether we can redo it in a quicker manner.
Thank you. Thank you, Dean City. Over to you, Dean YY.
Thanks, Warren. So I noticed the time is 12:30 already. So I wouldn't drag on the webinar for too long, but I do want to address this question, and I want to pose this to all our panelists. There is this question that it's around what should countries be looking at? What should people be looking at to decide on the impact or the severity of COVID-19? Because right now, obviously the World Health Organization, there are many, not just WHO, many other countries also look at the number of people in the country that's infected, the number of deaths that have happened in the country as an indication on how serious the outbreak is within a country. And that is why we have this fascination around second waves or third waves of infection, whereas there are people that are always tussling between the economy as well as public health to protect people. And I see this as a very important question here, because should we look beyond just the total number of cases or the new number of cases that are reported each day? Should we look beyond the number of deaths, as unfortunate and as horrendous as it sounds? But what should countries really be focusing on? Because it is a toss-up between lives and livelihood. And because we are running short of time, I just want a very short answer, perhaps just one sentence, 1 point from each of you. I will start with Dr. Awang. I saw you raise your hand. Just to perhaps illustrate based on your own knowledge and in your opinion, what do you think would be a better metric that countries, citizens can use to benchmark the impact or the severity of the situation in the country itself? Dr. Awang, first to you.
Thank you, Wei Wei. On the 4th of June, Malaysia launched what is called the Global COVID-19 Index, or GCI. Is available online. This is an index which measures countries' severity and also recovery from COVID-19. So the Global COVID-19 Index has many indicators inside it, and it takes into account even the Oxford Stringency Index. We're looking at what are the measures which the government has put in. It also looks at the health preparedness of systems in countries, plus some of the indicators which can be derived from the Johns Hopkins School of Engineering, and the data which can be pulled from there. So the index, which had got inputs from several people, including my own task force, as well as academics from Yale and Columbia, and our own Ministry of Health staff, and this was developed by a company, and this company was sponsored, partly sponsored this particular index for use by anyone in the world. So it's free for anyone to use. So it measures on a daily basis how well, how severe the COVID-19 epidemic is in that particular country, and how well the recovery is taking place. Of course, because the indicator, the index itself is pretty new, there are probably things which can be improved inside it. And in the first few indicators which were put in, I had asked them to change, because I thought that it didn't really reflect country's population demographics and the country's size and testing capacity and so on. But I think this is a good start, and it is an interesting way of looking at how countries have been responding and how we can measure the severity of the epidemic. Like I said, it's available online. So if you Google Global COVID COVID-19 index or GCI, you'll probably see it, and you'll see which countries are doing well. And they really correspond to which countries are on the downward trend and which of them have taken steps to recover and whether their recovery is going well or not. That's the Malaysian contribution, I think, for COVID-19.
Thank you, Awg. Over to our friend in Taiwan, Dr. Philip Loh, please.
My key word for this question is surge up capacity. Capacity for laboratory testing, capacity for hospitalization beds, is capacity for contact tracers when we are talking about contact investigation. How many have been trained and they are able to put into practice? So instead of just watching over the case numbers and the number of deaths, it's better to just look deeper into this capacity building process, and we'll have better prediction of how these countries are going to manage this wave, next wave, next wave properly in the future.
Thank you very much, Philip. And Dr. An from South Korea.
Okay, thank you. I think the impact is we can follow the Pulveris basic context. That means the instance and the mortality. But the question is which instance and what kind of mortality. For instance, to me, what I often use is the trends of the daily cases, per million population, because the population size is all different. So there's no any meaning to see the big number, small number without consideration of the population. So I always see per million population how many are daily cases, and then also see the trends, whether, so always I try to see whether we reach some country reach the peak or not. So trend of the daily cases. Second one is mortality, that the mortality case fatality rate based using the denominator, the reported cases based on the testing, also doesn't mean anything, because some countries diagnostic capacity is good or sometimes not. So what I try to see is that the IFR, infection fatality rate, instead of case fatality rate, meaning denominator of IFR is the number of the total of the people who are infected. For that, my overall sense is around COVID is 0.5% plus minus, and then, but for that we need to see the survey, ad hoc survey for antibody test, how many are affected. And for New York City, case fatality currently reported around 10%. But if we see the 20% of the population in New York City are affected, then it means the case fatality down around 10 times immediately. So that then the assumption is that I have two assumptions to using this, because one is eventually still is the early stage of the COVID, and then the many modelists they think that the 60 to 90% of the infection would be happening. If there is a case, then using this per million people, how many are dying or how many are getting the new infection. That is important. And then the second assumption I have is that we are still only second round of out of 9 round baseball. We are just the second round or first round out of 9 round games. Either herd immunity come first or the vaccine come first. Whichever the case, I believe it will take at least 1 year, so that even we are lucky. So that so I may continue to see the trends to get the big picture. Thank you.
Thank you, Dr. An. Your final message of second round out of a 9-round game. It's very well taken. So we are still very much in the early phase of the outbreak.
It means you have to organize this kind of again and again every round.
Well, for those that are dabbling in the stock markets, that will be a disastrous scenario to hear about. But anyway, Dean Siti, over to you.
Yes, I think I like the complex situation. So the index is very good, and thanks to Malaysia, I would prefer to see evidence-based plus the context, like the facility, medical and participatory decision making. I think those are three indicators of how we're going to proceed and success. So thank you.
Thank you, Dean CT. And Wah Yun, any thoughts from you to add to this?
Yes. I think there are several aspects that I think one should actually look into. One, of course, I truly agree with what Dr. Philip Law says. It's all about capacity building, in all the various aspects in the education, in the healthcare sectors. And unless and until, we can reinforce or empower our people in terms of capacity building, then only I think we can really fight this pandemic. Thank you. Thank you.
Thanks, Ryan. And I thought I will also leave with just 3 points, which is on this issue around how do we really decide how well or how poorly a country is currently being affected by COVID-19. It's in addition to what our fellow panelists has mentioned. I think let's not neglect our healthcare workers, the ability for countries to keep healthcare workers protected and safe, to minimize any hospital-acquired infections where they were infected as part of their duty, regardless of the extent of spread in the country. So a country could be doing very well, but if your healthcare workers are being infected as they carry out their work, I would think that your country is not doing that great. Second point is really the ability to provide the necessary healthcare financial coverage. And I think this is where Dean CT will agree completely, the financial protection for those that are infected, so they will not experience catastrophic poverty because of any related COVID-19 treatment. And I think the last point, which is always very important for us in global public health, is really the ability to provide and to protect and provide for the vulnerable and neglected sectors in communities, in countries, during the entire COVID-19 episode. Dr. An has mentioned we may still have 12 months ahead. And how are we helping others within our community or outside our own country to provide them with the necessary ability to protect against COVID-19. So these are just some final thoughts linked to questions that have been asked by our audience. So with that, I thought I've taken 12 minutes more of your life than we promised. And I do apologize on behalf of everyone that we cannot get to all the questions, but thank you to the audience for posing the questions and for attending the webinar. I hope it has been a very useful session as you learn about what different regions, different parts of the world are doing with respect to COVID-19. With that, thank you very much for your participation and do stay safe and keep well. Thank you. Goodbye.
Thank you. Bye.
Thank you very much. Bye-bye. Thank you very much, everyone. Wah Yun.
Thank you.
Thank you.
Thank you all.
Bye.
Bye.
Bye-bye.
Bye.